Hi guys, I'm reporting 2 days after surgery. I know I said I was going to post like the morning of surgery, but I was a little nervous and there's a lot of stuff going on and I just didn't even think about it. So, sorry. And every other time I was in the hospital after the surgery, I was so I was so tired and I was, I had a lot of morphine and stuff, so even if I would have posted, I would have probably been a little incoherent. So, I'll go ahead and post now. Like I said, it's 2 days after my surgery. It's Friday. It's Friday, and my surgery was on Wednesday. I'll just kind of tell you about what my experience was. We came in and checked in. Then a nurse came back and brought me up to my room, and there they had me like change into like a hospital gown, and they started an IV with some like anti-nausea, anti-anxiety, and just fluids before surgery. Had to put my hair in one like little hairnet thing and that kind of stuff, and yeah, we just kind of hung out and waited. I actually ended up having to wait a little longer because the two surgeries that were before mine actually went overtime a little bit. So instead of going in at 11:30 like I was supposed to, I actually didn't end up going back till about 12:30. So when it was that time, a couple of nurses, surgical nurses, came and picked me up and rolled me down the hall to the operating room, and then basically I had to maneuver onto the surgical table from the bed that I was in, and yep, then they put me out, and the next thing I remember, I woke up in the recovery room, and I can hardly even remember what the room looked like. I was just kind of like, and they were kind of asking me how I was feeling, and I just remember I was really nauseated, like, I was really nauseated, and I was in some pain, so they gave me some more anti-nausea and anti-pain medication. So then they wheeled me back to my room, and my mom and my dad and my stepmom were there, and I basically came back in and I fell asleep again. Like, I was just out of it. But when I did start waking up, my mouth was really dry. So the first day of surgery, they only allowed me to have like an ounce of ice chips every hour. So I was definitely like looking forward to that because my mouth was so dry the entire time. And yep. They had me up walking around a few hours after surgery. Also, I don't think I mentioned this, but the first things they did when I came in, after me getting like my gown on and everything, is they put on some Ted hose, which is those anti-embolism socks. They're like white and they're really hard to get on. Yeah, so I was wearing those to help prevent like blood clots and stuff like that. But yeah, they wanted me up and kind of walking around, to help prevent blood clots and pneumonia and all that kind of stuff. So I got up and walked around once the first day of surgery, which is kind of their goal. And then after that, like I said, I was just mostly sleeping the entire time. I kind of talked a little bit to people. My grandpa came, and my stepdad came, and my sister came, and, a bunch of people, family came up, and I kind of talked to him, but not really, because I was so tired, but the next morning, early in the morning, they took out my catheter, and they said one of the things before I could leave was I had to be able to urinate by myself, so, which I did, just not right away, but a few hours after they took the catheter out, I was able to, so that was a relief, because I did not want to get straight cath. That would have been no fun. Let's see, what else? Oh yeah, second day, they started offering me, like, broth and Jello. And the first broth and Jello and water that I attempted made me feel really nauseated, so I just kind of was like, oh, not yet, not eating that. Especially the Jello, I don't know. Hospital Jello has a very strange consistency anyway, but I was not having that. So then a few hours later we tried again, and it was broth, and I think it was just broth, and I took a few sips of it, but then I was really full. But eventually, I was able to keep down, I ate about half of a popsicle and half a cup of broth. It took me probably like an hour and a half to do that, but I did, so that was good. Then I walked around a couple more times, and I ended up being discharged around like 3:30. So, most of the time, the doctor sends you home with a prescription for like Arixtra or Lovenox, like a blood thinner, for you to inject yourself with, like every day after surgery, and they do it to you in the hospital as well. And I actually, crazy as it is, we went ahead and got the prescription before we came to the hospital so we'd have it. And then when the doctor came to talk to us the day after surgery, he was like, oh, I don't want you guys to use that, or I don't want you to use the blood thinner. And we're like, oh, we already got it. And so that was basically, that sucked because it was like $65 and we couldn't even use it. But we actually were able to find some other, an older couple in the hospital, which one of them was having a surgery, and we were able to give it to them because they couldn't afford it. So that felt pretty good that we could help someone else, have the medication that they really needed to help them be successful with this surgery. So, yep. Yeah. So, I guess I can show you my scars from surgery. I have 5 incisions, and only one of them is really painful. They also, before I do that, they put a drain in you after surgery to help, drain any extra liquids or, bad serous fluid, basically, from your body. And so it's just basically a tube that's in your stomach, and it hangs off to the side. And they were draining it, every couple hours, checking it and stuff. And the morning after surgery, the surgeon comes and takes it out. I'm not going to lie, I didn't like it when he took it out. It felt very weird. And it was a bit painful, yes, but it felt really weird. It felt like it was the weirdest feeling, having something like slipping through your body as he's pulling it out. It was weird. I didn't like that, but I'm glad it's out for sure. But still, no fun. Okay, well, I guess I will show you my scars, and then I'll probably get going. Here, let me come over here so it's in the light more. Okay, here we go. Okay, right here, that's the one where they pulled my stomach out, so it hurts the worst. This is my sorest scar that I have, or incision. I'll zoom out a little bit. These two are just little ones. They don't really hurt at all. Then I have one in my belly button right there. That it doesn't really hurt. And then this right here is where the drain was, so there's no staples in it. But yeah, this is the one that hurts the most. So, yeah. Okay. Let's see. Also, I'll talk back on Wednesday for sure, because that'd be exactly a week since my surgery, and I'll tell you my weight and stuff then. The last time I weighed was actually at my grandmother's house, and I was 314.5. So, and that was, wow, like a week ago from today. So last I weighed, but I'm not at my grandma's house anymore, so my weight may register different on a different scale. I'm actually going to use like the Wii Fit to do my weigh-ins, because it can keep track of them. So I'm not sure what the difference is, but I do have to change scales. So I'm going to go off this scale on the Wii from now on, and I will tell you guys my weight on Wednesday. Alright, thanks guys. See you later.